Jonathon, so glad you could be with me and talk to me about what you're working on with Beyond Lucid Technologies.
So, Beyond Lucid Technologies is an unusual company in healthcare IT in that, A, we've been around for a while. We're more than a decade old. We are unusual in that we have an economic model that is successful,
Okay.
and self-sustaining and growing. And our focus is to ensure that emergency responders who are in the field have the ability to have insight on the patients that they are taking care of. So, for example, if they have a history of known illness, if they have an end-of-life medical order that might cause them not to do CPR or other resuscitation, or most recently, in the most emotional work we've ever done, making sure that a child with a special health need, a medical complexity, that the responders know that before they arrive.
Yeah.
We help them collect that information, convey that information throughout the healthcare chain, and then do follow-up on them afterwards to make sure that folks are not coming back to a healthcare system unnecessarily.
I think a lot of people don't understand or appreciate this challenge. So paint us a picture of how in the current EMS system, how you're coming in blind and how that could really negatively impact somebody.
Yeah, it's a really compelling thing. So it kind of ain't like it is on TV, although sometimes actually there are some TV shows now that are quite accurate in terms of really the size up, the scenario of what you are going to find and how many patients you're even going to find. You often don't know that until you get there. So, for example, a category that we are genuinely creating, it's really exciting. The first time I'm ever going to talk about this on record, automotive healthcare informatics.
Okay.
So imagine a situation, lots of people have heard of systems like OnStar, right? Wonderful technology to tell you if a airbag has gone off in a crash, if where the vehicle crash has taken place, etc. Velocity of impact in a new vehicle. What it doesn't tell you is, let's say you're driving a minivan and you have 6 people in the car, right? So in a normal situation, a non-disaster related situation like a 9/11 type scenario, you can take at most 2 patients in an ambulance. So if you have 2 parents, 2 kids, and 2 friends, you actually need 3 ambulances, not 1.
Wow.
And currently, that decision doesn't even happen until the first one arrives on scene and realizes it needs more ambulances.
Yeah.
If you're in rural Texas or rural California, somewhere along the I-5 corridor, that may be a 30-minute transport just for the next vehicle to get on scene. So that process is extremely manual today. There's a lot of work going into the dispatching process now, a lot of money going into the dispatching process around things called next generation 911 to try to provide more information, but they still don't provide any information about the people who have been impacted. So that's what we're doing. So again, our mission is to ensure that the responders, when they show up, have access to historical data, have access to contextual data, can say, Logan has a history of X, or he has an allergy to certain medication, or here's his next of kin, here's his medical order, right? If we show up and again, we know that there's a child who's gonna react badly to a siren, for example, or the lights will cause them to go into seizure, wouldn't it be amazing if you could know that before you get to the car?
Wow.
And the same scenario outside of a vehicle situation. It is a truly manual stepwise process, and one of the things that got us into this business to begin with was the literature showed about 50% or so of critical information lost at each node of handoff in a mobile medical environment. So to the degree that we could close that gap, that's what got us into this business more than a decade ago.
So you're describing kind of an OnStar for health, which is a really cool concept and one that's really compelling.
Glad those came out of your mouth, by the way, not mine.
Okay.
I like that.
And where are you at in that process? It feels like an interesting challenge in terms of bringing together really disparate pieces of the puzzle. There's a lot of players, a lot of stakeholders in this. So kind of where are you at in that process?
So the initial targeted launch of that product is actually the second half of this year. So we won a patent on this last February. We've been working on this since 2016. Everything that we have been working for, all of the interoperability, we've got more than 300 hospitals on our network right now. We cover 30 states and actually have 2 countries under coverage for the EMS side of things. We're a little team, by the way, so we're hungry and we work hard, but the entrepreneurship at its finest. The idea that every deployment we've done, every community we've touched has actually been laying the groundwork for this next phase of the business. And with kudos to both Steve Krein and former colleague Paulina Hammond, who a number of years ago helped us frame this story, make sure that it was pretty clear to all that we work with that the extensions based on the architecture underlying, we call the MetaView Beacon Pre-Hospital Health Information Exchange, is really the enabling technology underlying what will be Halcyon post-crash intelligence. And I'm very proud, extremely proud, that our first partner client to raise their hand to utilize Halcyon is an existing MetaView customer. It turns out, partner client. I never like to refer to my team members and partners as customers. But they recognized that an ambulance is a fleet vehicle, right? There are people in the back and there are people in the front. And ambulances and fire vehicles get into crashes far too often. So imagine if another vehicle has to show up on scene to take care of you, wouldn't you want them to know who was in this vehicle and be able to be empowered to know their health information as well? So to have one part of our business essentially empowering the other has accelerated that significantly. Like I said, we won a patent on the entire process about a year ago, so it's been a very exciting time in our
Congratulations. You said that you have a distinction for being in the market for more than a decade, but also being profitable, which truly is among startups a distinction. What's a piece of advice that you would give to a founder who's a few steps, they're pre-profitable?
It was an easy one.
About how to make that happen.
That's an easy one. Follow the value proposition.
Okay.
It's not even follow the money. The money actually is the easy part. And that's a remarkable thing to be able to come out of my mouth. But getting people to part with their money is not hard. Being able to define how you're going to help them, that's hard. And so being able to say, and even more streamlined than I'm probably being right now, right? What is the pain point that I can solve that you are willing to pay me for? In business school, we call that willingness to pay, but it really is a question of if your pain can be traced to paper, it can be traced to the inability to get paid, if it can be traced to the fact that somebody, again, imagine if you resuscitated a person who turns out later didn't want to be resuscitated. Forget the mental anguish associated with that, which is substantial. You also may end up dealing with lawsuits for the next number of years, right? So we follow the value proposition, and basically if I can come in at or below your current expense and provide value on top of it, then it becomes a no-brainer to say this tool can help me get where I'm trying to go in terms of hard costs and hard dollars, which is what a longtime team member, our first chief medical officer once told me. He said, if you're going to talk to clinicians, don't talk about fluffy things like making people better. That's hard to measure. Talk about hard dollars, hard costs, hard measurements. Where can I show measurable improvements in process? And then you can put a dollar figure on those. And as long as you are true to your word and willing to deliver it, folks will come.
Awesome. Awesome. Jonathon, thank you for sharing with me. I thank you for continuing to push for as long as you have in an area that I have personal love and passion for, in emergency medicine and EMS. It doesn't always get the attention and the innovation that it needs, and you've been there a long time, so I appreciate that.
Thank you. Pleasure's all mine.
Thank you, sir. Have a great conference.